Press your hand against your belly right now. Is it soft, like a pillow under the skin, or does it feel tight and firm, almost like there's a small basketball under the surface? If it feels hard, listen to me closely. That firmness is often not just middle-age spread. It's a metabolic signal. It often means visceral fat, the kind that packs around your organs, and that's linked to a fatty liver, rising insulin resistance, and the hormone shifts many of us face in midlife. This isn't about shame. It's about a clue your body is giving you, and there are simple, evidence-aligned steps you can take to reverse what I call stress aging, and often improve how you look and feel. If this is helpful, hit like and subscribe so you don't miss the next practical guide. Here's the short version of what's happening. For years, estrogen helped guide fat to hips and thighs. As estrogen declines in peri and menopause, the body tends to redirect storage toward the abdomen. At the same time, long hours of liquid calories, stress, and constant snacking can overload the liver with sugar and glycogen. When the liver is full, the excess is shuttled into deeper stores, around organs, as visceral fat. Insulin and cortisol are the hormonal drivers. Insulin promotes storage. Cortisol, especially when chronic, pushes fat to the belly and keeps blood sugar high. Think of the liver like a suitcase. When it's overpacked, the overflow spills into the trunk, your visceral layer. That's why the belly can feel hard before it actually shrinks. Now the 3-step visceral flush protocol. Each step is simple, practical, and sustainable. None of these promise a miracle. They can, however, help your body stop adding fuel to the problem and begin using those deep stores, often producing a softer abdomen and better metabolic markers over time. Step 1. Liquid Carb Zero. Why it works. Liquid sugar hits the liver fast and keeps it loaded, pausing fat burning. What to do? Stop drinking calories and alcohol. That means no soda, fruit juice, sweetened coffee drinks, smoothies with added sugars, or regular cocktails. Choose water, sparkling water, or unsweetened tea and coffee. If you enjoy a little flavor, add a wedge of lemon, a splash of unsweetened almond milk, or naturally flavored sparkling water. Practical tip. In social settings, swap one cocktail for a sparkling water with lime. If you crave sweetness, try chilled herbal tea or dilute fruit juice heavily and treat it as an occasional taste, not a daily habit. Beginner modification. Start by cutting out one liquid source of sugar per day. Replace your afternoon sweetened coffee with plain cold brew or flavored sparkling water and build from there. Step 2. Zone 2. Cardio. Why it works. Low to moderate steady-state cardio trains the body to burn fat without spiking cortisol or stressing the system. What to do? Aim for about 45 minutes of Zone 2 exercise 4 times a week. Zone 2 is the intensity where you can hold a conversation without gasping, brisk walking, easy cycling, or a steady elliptical session. Practical tip. Use the talk test. If you can speak in full sentences comfortably, you're likely in Zone 2. If 45 straight minutes feels intimidating, split it into 2 25-minute sessions or add a gentle 15-20-minute walk after meals. Beginner modification. Start with 3 30-minute walks per week and increase as tolerated. Safety note. If you take heart medications or have cardiovascular concerns, check with your clinician about target exertion and any monitor you should use. Step 3. Extend the fastest pompunwani. Zakwasis aya soti meal spacing. Why it works. Allowing the liver to empty its glycogen stores encourages the body to tap into visceral fat for energy. What to do? Aim for 4 to 5 hour gaps between meals and a 14-16 hour overnight fast most days. Practically, that might mean finishing dinner by 7 p.m. and delaying breakfast until 9 a.m. the next day. Or keep dinner and breakfast times consistent so your overnight fast reaches that 14-16 hour window. Practical tip. If mornings are rough, start by pushing breakfast 30-60 minutes later, or skip late night snacking. Sip water, black coffee, or herbal tea during the fast if you need something warm. Beginner modification. Begin with a 12-hour nightly fast and lengthen it by 15-30 minutes every few days until you reach 14 hours. Proceed to 15-16 hours only as tolerated. Safety note. Anyone with diabetes, on blood sugar lowering medications, pregnant or breastfeeding, or with a history of eating disorders should consult their healthcare provider before changing meal timing. How to measure progress. Use the same press test you started with. The belly often softens before it becomes visibly smaller. That softening, less tightness, and less pressure under your fingers can show up in about 2 weeks with consistent practice of the 3 steps. Retest the same way at the same time of day wearing similar clothing. Track small wins, easier buttoning on pants, less post-meal bloating, better sleep, or lower cravings. Those are all signals the metabolism is shifting. A few practical pointers to keep this sustainable. First, consistency beats intensity. Low-stress changes you can maintain for months will outperform short, extreme bursts. Second, prioritize sleep and stress management. Chronic poor sleep raises cortisol and undermines all 3 steps. Third, protein at meals and some fiber will help control appetite and stabilize blood sugar. Finally, be patient with your body. These changes often reduce metabolic age more than just numbers on a scale. Better energy, clearer skin, improved mood, and a firmer feeling midsection are common. A concise safety note. This guidance is general. If you have diabetes, take insulin or other glucose-lowering drugs, have known liver disease, are pregnant, breastfeeding, or have significant medical issues, consult your clinician before changing diet or exercise routines. Do not stop or adjust medications without medical advice. The belly press is a useful self-check, not a definitive diagnosis. If you're concerned, ask your healthcare provider about testing for fatty liver or metabolic risk. To recap, 1. Liquid carb zero. Stop drinking calories and alcohol so the liver can begin to empty. 2. Zone 2. Cardio. 45 minutes, about 4 times a week, done at a comfortable conversation pace to favor fat burning without excess stress. 3. Extend the fast. 4 to 5 hour meal gaps and a 14-16 hour overnight fast most days to encourage the body to tap visceral stores. Retest the press in roughly 2 weeks and look for softening before you expect visible shrinkage. This protocol doesn't promise a fixed number of years back on your face, but it does give clear, science-aligned tools that often reverse stress-related aging signs and improve metabolic health. And many people report looking and feeling years younger as a result. I want to hear from you. Press your hand now, hard or soft. Comment below. I read every reply and will respond. If you're unsure about your health situation, please speak with your healthcare provider before starting. Keep going. You can change this trajectory, one small habit at a time.